So, hello everyone. Warm greetings, World Pharmacist today. So, today is 16th World Pharmacist Day, and this time the theme given by FIP is Think Health, Think Pharmacist. And on this occasion, I will be today delivering this lecture on role of pharmacist in training and education. So, pharmacist is one of the major concern player in the healthcare of Nepal. Before starting the lecture, I would like to acknowledge the chairman of the institution, Shri Praveen Gargji, director Dr. G.D. Gupta, principal campus 2 ISFCP, Dr. R.K. Narang, all the HODs, students, and dear pharmacists, students and participants. So, the role of pharmacist in training and education. And in the role of pharmacy, we go with the community pharmacy, hospital pharmacy, clinical pharmacy, electronic pharmacy, social pharmacy, etc. are the various job roles. So in the pharmacy, we have of peoples in the community or in the society that is called as community pharmacy, where various peoples comes for OTC drugs, prescription drugs, we have to take care of them. Hospital pharmacist, hospital pharmacy where the inpatients more OPD are coming. Clinical pharmacy detecting adverse drug reactions, medication errors, prescription audits, management of medications, antimicrobial stewardship programs, and also various things. Electronic pharmacy, e-pharmacy, particularly into that online prescriptions. And the next part is social and administrative pharmacy or preventive pharmacy called social pharmacy. Currently in India, there are such kind of practices are done in the pharmaceutical sector. Whereas the other sectors are the productions, quality assurance, regulatory affairs, pharmaceuticals, nutraceuticals, bulk industry, regulatory plants, bulk industry, etc. So the pharmacists have to maintain the ethos, the morals, the etiquettes, no cutthroat competition. The pharmacist should render the services to clinics, nursing homes, interdepartmental communication, teamwork, etc. The requirement of the hour. On-job training, so continue pharmacy education programs, action programs, job rotations, company health and safety programs, external vendors for training, local training, overseas training, internal trainings are part of it. So I'm telling this point that when it's come to the pharmacy practice, where we need to see that if I'm gonna do this process, in this process, what is my role of training? If I do the training portion, what is the competency in the training? So, job training means where you are luckily getting yourself enrolled with the job rotations, company health and safety programmings. You are doing a overseas training for 3 months or internal trainings like coming with the processings of various things. If I say we as a pharmacist tends to do the workflow, tends to do the work, we need to see the what is the manual and the SOP of pharmacy. In the SOP of pharmacy and training of pharmacy, our job role very clear. Our job role is to understand that when we go for our job, what things we have to do over there. And in that job capacity, are we able to perform our daily task assigned by higher authorities or officials to us? In most of the cases, what is happening? We are unable to perform the task due to the intelligence problems. So human intelligence, artificial intelligence, and emotional all together we have to take care of our feelings, of our personal perceptions, of our technical support. So having a good mindset to perform that job role. So that is why on-job trainings are required. When we go to the hospitals, we have chief nursing officer, nursing superintendent, deputy nursing superintendent, assistant nursing superintendent, ward sister, clinical supervisor, staff nurse, ANM, GNM, students of nursings, community pharmacy, where the conduct of pharmacy, handling of prescription, handling and storage of drugs, apprentice, price structure, fair trade practice, purchase of drugs, hawkings of drugs, etc. are the part. So what happens in the community pharmacy? The conduct of pharmacy, handling of prescription, handling and storage of drugs are the major concern. So price structure, fair trade practice, purchase of drugs, hawkings of drugs, no black marketing, doing community health screening services, capillary blood glucose, blood pressure monitoring, hemoglobin measurement, blood pressure management and measurement, vital signs monitoring including pulse oximetry, triglyceride level, glucose level, etc. to be monitored properly. With the professional activity and communication with the public health, professional vigilance, you should be a law-abiding citizen, maintaining the decorum, property, and medication. So a community pharmacist is one pharmacist who is or in the community or in the society to take care of the peoples. So generally what happens when this thing is not happening? Problem occurs. So advertisement and display, immunizations, minor major testings, prevention of tropical diseases like dengue, malaria, chikungunya, etc. Performing the task for the drug information services, poison information services, adverse drug reactions, and any misuse of the drugs. Then the next is the nutrition counseling, family planning, smoking, cessation, STDs, rational use of drugs, women welfare, pregnancy and infant care, drug therapy, personalized medicines. With communication skills and information technology, pharmacists be well aware with the MAC, SOPs and the manuals, the guidelines, where http www.com, EBM, general clubs, abstracting, and email services are required. So pharmacy, pharmacist, pharmacy assistant, pharmacy technician, continuing pharmacy education program are the need of the, as well as you need to see that any kind of research, meta-analysis, randomized clinical trials or trials. So clinical trial registry of India, along with it, Human Ethics Committee, Research Advisory Board, right from the clinical trial application to the biological license, post-marketing, surveillance, toxicity, mutagenicity, carcinogenicity studies. From that perspective to the and other things. This is one of the point where the things takes place. Pharmacists should be well versed with the Pharmacovigilance Program of India and CDSCO, that is Central Drug Standard Control Organization, where updates on the PVPI and we as ISF College of Pharmacy is running one of the ADR monitoring center for conducting the drug reactions. So BPI is one of them, because where we go, we see that to believe that drugs causes some problems, and they might have been having that problems maybe resolved. Okay, so signal detections and any drug stop order. So this is the need of the hour, which is going on worldwide, and this PVPI Pharmacovigilance Program of India you can enroll on toll-free ADR reporting. My next concern is pharmacists want to serve abroad. And in the abroad condition, Australia, earlier it was having CAPS examination, now OPRA, overseas pharmacist evaluation test. They should have a language requirement like IELTS, OET, TOEFL, GR. When it comes to the Canada, Pharmacist Evaluation Board of Canada, along with the qualifying exam called OSCE, Objective Structured Clinical Examination. For the United Kingdom, Royal Pharmaceutical Society of Great Britain, IELTS is required. The test is OSPAP, Overseas Pharmacist Assessment. Yeah. You need to have the society's registration examination. USA is having this NAPLEX, North American Pharmacist Licensure Examination, where FPGEE you need to give it. Whereas if you to go to the uh, Gulf nations like Abu Dhabi, Saudi, Qatar, Muscat, Oman, Bahrain. So in that case, you have to have the Ministry of Health, Dubai Health Authority, and so for MOH and DOS test you have to give. Every nation have their structure in terms of study in pharmacy, and based on to the number of years experience, the type of degree you do, degree title, the clinical residency, special training, licensing certification, relicensure requirement, continuing education required for renewal, prescribing authority. So France, German, Australia, UK, US, everywhere there are some websites and resources available. Become a MSc abroad. Canada, Singapore, etc. So every college, when you go have the staff, teachers, faculty, student, universities, all are the major key player roles, really key players, and you have the education regulation, then the PharmD regulation 2000 and B.Pharm regulation 14, M.Pharm regulation 14, B.Pharm practice in 2014, pharmacy teachers regulations in 14, pharmacy practice regulation 15, and education's regulation 2020 for the D.Pharma. And to become the process, if you want to register in the UAE, this is the process you have to go through with the Arabic examination. In Arabic, the pharmacist is called a Sadaliya. And Sadaliya has to perform his duty or her duty at the UAE. Same in US, same in Canada, wherein a couple of types of parts, rotational access is there. So you have to give PVC as well as OSCE. As you want to go to the Australia, the CAPS examination is there. Now the CAPS is renamed as OPERA. So in the OPERA examination, you can go with it. So occupational English test, OET, is to be given. And from that NAPLEX, yeah, that one of the question for DHA, Dubai Health Authority. So that will is conducted by the Dubai Health Authority test by Ministry of Health in the Dubai, and several kind of experience is required of couple of years of a hospital pharmacist, as I got a question from the chat, YouTube chat box. So NAPLEX is divided into 4 registration steps. You have to clear the authorization to test, attend AATT test. You have to register yourself. You have to wait for the ATT. Then you have to schedule an appointment and take an exam for NAPLEX. So medicines are having the problems. Now they are losing the power, that is antimicrobial resistance. So multi-drug resistance, loss drugs, storage, and withdrawal of some new some medicines from the market like Avendia, Rostiglatazone, etc. So why education, training, internships, projects, etc. are required? Because this CEP programs for pharmacists, physicians, nurses, training pharmacy students in internships, providing residency programs. Hospital pharmacists may participate in research conducted in the hospital, publishing newsletters accessible to staff and public. Community pharmacy bridges gap between general physician, nursing staff, other healthcare professionals and public. Work from pharmacies with their responsibilities or with the responsibilities of dispensing and distributing medicines in supermarkets, pharmacy shops, healthcare centers, checking doses and ensuring that medicines are correctly and safely supplied and labeled, counseling and advising the public on the treatment of minor ailments, monitoring blood pressure and cholesterol levels, offering our diabetes screening services, family planning, alcohol withdrawal, lifestyle and nutritional habits. What are the role of pharmacist? Community pharmacy, clinical, hospital pharmacy, industrial pharmacy, academic pharmacy, regulatory pharmacy, R&D, herbal pharmacy, and many more. So, education and training is one of the part where you do on-job training, on hospital training, on community pharmacy training, and a wide scope of educational programs involve nursing staffs, doctors, etc. Train newly employed pharmacy department personnel. So, what is the content of pharmaceutical education as per the Pharmacy Act? We go and we do check about the current status and current things of the pharmacy. So, in the current scenario, as per the curriculum, AI and many more things are coming. One famous scientist, Dr. Isaac, has told sometime you have to do every day yourself update in the field of pharmacy profession. It plays yourself to dedicate, contribute in discovery, development, production, distribution of drug products, and in the creation of dissemination of knowledge required in the pharmaceutical sciences. So, Sir Isaac Newton told that if you want to add knowledge in your field, you have to be updated. And this is the direct patient care. You are taking responsibility of their diagnostics, therapeutics, and updating them about the knowledge. Our pharmacy field plays a vital role and a pivotal role into the different categories like biotech, genomics, combinational chemistry, screening technologies, bioinformatics, and major advances, which gives a new direction to pharmaceutical sciences. So, pharmaceutical education has to set new priorities to keep pace with the challenges related to genomic technologies. Whereas the educators and the pharmacy school members have to take the responsibility of deciding how the things will get up. That set up in the programs to be developed. A better integration of internationally educated pharmacists within the domestic workforce and professional development and maintenance of competency of practitioners. So in hospital pharmacy services, pharmacies are premises license for retail sale or supply to the hospital which have qualified licensed person and indulged in compounding of drugs. So the Pharmacy Act was passed in 1948, which rationalized the pharmacy services. And the Act was amended from time to time in 1959 and 76. The Act regulates the practice of pharmacy as stable responsibility, which regulates minimum educational qualification by central government, and the pharmacy is responsible for providing safe medication to the patients. So if you go to the US, there is a director of pharmacy, associate director, administrative services division, unit dose division, and training and education division, where the departmental services, purchase, inventory control, manufacturing, packaging, etc., billing are told, dispensing cycle is being taught. Otherwise, unit dose dispensing, R&D pharmacist, pharmacy, specialization of nuclear pharmacy, radiopharmaceuticals, drug information services. Then SAQC department, sterile products, central supply division, etc., IV admixtures. So role of pharmacy is ever changing. In pharmacy practice, you need to maintain the records, drug store, purchasing, receiving, inspecting, quality test, storage, distribution, various compounding and manufacturing of loads, sterile waters, mixtures, ensuring potency and quality of drugs procured, compounded and distributed, dispensing prescriptions to inpatients and outpatients as per physician's prescription, maintaining information on quality, cost, source of supply, drug reaction, investigate adverse drug reaction with withdrawal of supply, ensuring adherence to laws, acts, rules, and regulations of drug controller and applicable to storage and use, to promote economy in use of drugs, establishing accounting procedures and utilization, strict implementations of policies and guidelines of therapeutic committee, assist in training, teaching, research, and drug trials, education of patients and relatives about drug use, maintaining of proper receipt, utilization, and storage record, periodic inspection by chief medical officer in charge pharmacy or drug controller. So, what is the role of pharmacist in the National TB Control Program? DOTS directly observe treatment short course and diagnostics, Montauk's test, sputum test, and counseling awareness, and DOTS plus also. The pharmacist job roles varies from category to category, patient to patient, where the communication, ethics, educations, responsibilities, designing patient information leaflets, total parental nutrition, and patients' roles in apprentice pharmacist, on-job training, and views on nutritional support team, etc. Where total parental nutrition and compounding, monitoring, management, quality improvement and research, nutrition assessment and prescribing, developing and implementing the nutrition care plan, and education, training, research, importance of research in hospital pharmacy, promotion, better services for patients, better opportunity for pharmacist care, gain knowledge, prosper for the country, other things. So where we can go for patient-specific services, facility-specific services, global services. And the role of the pharmacist as given by the WHO as 7-star pharmacist is caregiver, decision maker, communicator, leader, manager, entrepreneur, lifelong learner, and teacher. And in clinical pharmacy, when you go, quality assurance, technical, QC, medicine, information technology, R&D, education and training, medicine supply and dispensary, etc. takes parts. In clinical medicine, information and collaboration, communication, coordination for the outcome of public health, in-depth knowledge, patient counseling, dispensing cycle, accountability, antiretroviral therapy, essential medicines, availability, affordability, follow-up of expiry products, and maintaining the good pharmacy practice compliance, making skilled pharmacists for the future for training and mentoring them. Into the professional competency and leadership skills with the time constraint for funding, service delivery, implementing themselves into various pharmaceuticals and economic efficiency, healthcare systems, public policy, increased collaboration between healthcare professionals are the requirement of the time. Quality of life certified pharmacist system where QOL cancer, QOL diabetes, elderly person drug therapy, QOL home care, palliative care, mental illness are the part. Standards and supporting themes at a glance. Professional standards for public health services where we have to follow the standard treatment guideline, analysis, sharing data, integrated disease surveillance program, information, education, communication, conducting CEPs. Last Sunday only I gave a lecture in Himachal Pradesh Pharmacy Council on drug store management. I have given some lectures in Gujarat State Pharmacy Council. Being as a member Pharmacy Council of India Madhya Pradesh State Branch, particularly Education Regulation Committee, our role is to do the refresher programs for the pharmacist or continuing pharmacy education program. In that, case management, service management, adherence, gynae, nutritional outreach activity with the ethics. Be honest, maintain competence, show leadership, work with others, communicate effectively, act professionally, put the patient first. A patient is a nurse care manager, lab radiology pharmacy, behavioral health specialist, medical assistant, specialist dentist, etc. A nurse, a pharmacist, a biochemist, a chemist, biologist, physician, physicist is a part of team. So integrated disease surveillance program where you come to know how many number of cases of daily disease is coming up. So FIP started this FIP in the year 1912 in the city of the Netherlands, and the city was Hague. The Hague was the city, and right now this members have various things. So in pharmacy education, you can learn, live, lead in community, hospital, industry, academia with UG, PG, various levels, and internal training programs and external training programs helps to achieve the problems. So first of all, Christian Medical College Hospital, Vellore was the one who involved in academic teaching of medical pharmacy and nursing students. On one hand, on a variety of in-service training schemes for practicing pharmacists and nursing through a continuing education programs of pharmacists and nursing are still unknown even to the hospitals. Training of students and nurses in US has been practiced by ANM, GNM or BSc nursing, MSc nursing, as well as for the medico CMEs are being conducting, where the lectures in the therapeutics, diagnostics, pharmacology, pharmacy practice, toxicology are delivered. Seminars for the nursing medical staff where the location of the pharmacy personnel, hours of operations, and hospital logicals and policies, philosophy, goals of hospital pharmacy, pharmacy therapeutic committee, management of hospital pharmacy, and certainly this suggestive topics concerns with the compatibilities, drug-drug interaction, drug-food interactions, pharmacovigilance, cost of medication, so-called pharmacoeconomics, amendment with the new drug regulations, Drugs and Cosmetics Act, Rule Pharmacy Practice Act 2015, Pharmacy Act 1948, and various drug-related problems. So for this, we have a separate segmentation, and where we can understand the drug darium, conduct pharmaceutical manufacturing program on GMP, and narcotics and psychotropic control drug substances control procedures, conduct teaching and in-service training programs, ability to conduct and participate in research, ability to administer and manage a hospital pharmacy. And patient education is a very must, in the patient education, the role to understand that their role is wider role. So training clinical pharmacists as per NABH, MOM operations, and this all the parts takes up. So this is all for the today. And if you guys have any questions, you can ask to me. So as I can see, Dr. Abhishek is with me, and he's asked about the DHR. Huh? DHA syllabus. Let me tell you, you have asked about the DHA syllabus. So let me tell you, toxicology, medicinal chemistry, infection control, pharmacokinetics, and particularly pharmaceutical care, disease management, over-the-counter drugs, P drugs, laws, jurisprudence, ecology, therapeutic decision making, and pharmacognosy and dietary supplements, pharmacy calculation and compounding, clinical genomics, and you have around 3 hours for this. 150 questions comes for DHA, and fees is around, pass score is around 60%, and around $240 US is the fees for the same, and you have to give a code. and this comes into the allied health as a pharmacist. So this is the syllabus of DHA. So there are various things you come to know, and every official website I have written, if you will go into the class, you can go that website and you can thoroughly check out. It is given into the syllabus. Now you know everything is like a Wikipedia. You can search on the Google and you can find it in the details. So any other questions? So no such other questions. So thank you so much, ladies and gentlemen, for your patience listening. And tomorrow we'll meet with some new topic. So thank you so much.